Welcome back to my channel, everyone. I hope you've had an amazing week. My name's Dr. Daniel Follows and this is GP Made Easy. So over the next few videos we're going to be covering palliative care, including topics such as how to manage common symptoms in palliative care and palliative care emergencies. But today we're going to be focusing on how to provide caring and effective care for patients approaching end of life. But before we go ahead, don't forget to like, comment and subscribe so I know that you're enjoying this content. But on with the video! So first of all, a little bit of background information. So palliative care is specialised medical care for people living with a life-limiting illness, focusing on improving quality of life by relieving symptoms, pain and stress. Now this doesn't just apply to cancer, but to any medical condition reaching the end stages. And it tends to be when you think that someone's got about 12 months left to live. Now it can be difficult to predict, but there is some rough guidance. So up here, I've got a diagram from the gold standards framework. And as you can see, it's got certain medical conditions, and underneath each condition, there are certain symptoms that suggest that they are approaching end of life. Now, the trajectory of conditions can be difficult to predict as well, because everyone doesn't follow the same trend. So up here, I've got some of the commonest ways it can happen, where someone can be, for example, fine for a long period of time, and then suddenly just deteriorate. They can have ways where they gradually decrease over time until death. And there are times where people can be stable for a bit, then have a sudden drop, stable for a bit, or a sudden drop. Or there is some cases where people can be fine and then just have a sudden death. So when you identify someone who is approaching end of life, then the first thing to do is have that initial conversation with them. Now these tips are some tips from a primary care / family medicine perspective. So if you guys have any other tips from any other specialties or what you've come across, then please comment down below as it would be very helpful. So first of all, to make sure you don't shock the patient, I tend to start with a question. So I ask them what they understand has been going on so far, and you give them that time and opportunity to explain everything that they have gone through. Then the next step would be for you to have a conversation, and that will obviously be guided by the first question of how much they understand is going on. I intend to summarise everything that they've been through and what you know as well, to pass it on to them. And what's a good tip to do is what's called a bit of chunk and check. So you give a bit of information and then either ask them a question, see what they've understood, and you can go over things again if you need to. And at the end of any big conversation, it's always good to do a summary as well, to summarise the main points to make sure that it is further reinforced in their memory. And then the next step would be to actually talk about palliative care, that they're reaching the end stages and what palliative care is about and what it involves. And as well, make sure you give them plenty of opportunity to ask any questions as you go along. Okay, so you've now explained to the patient about palliative care, and then the next step is to move on to what we call advanced care planning. And this is where you focus on managing their medications, their symptoms, and what their future wishes would be to provide holistic care for the patient. So first of all, I would start with gathering some information about their beliefs and what their future wishes would be. So this is, for example, if they would want to go into hospital for any treatments at all, say if they had a severe infection needing IV antibiotics, or if they got very dehydrated and wanted fluids, or if they would prefer to stay at home at all times, or if they may want to be admitted into a hospice at any point. Another thing to discuss with patients, if you think it is appropriate, would be about an advance directive. Now this is a legal document that a patient signs when they have capacity, and it just states their wishes if they were to lose capacity at any point, if there are certain things they would absolutely not want doing at all. And then next I would move on to discussing about CPR and their wishes for that. So whether they do want to be resuscitated if their heart were to stop, or if they wouldn't. And how I tend to explain it is, I explain to them, we'll try to keep you as comfortable as we can, but there is always a point when people become very unwell, that their heart were to stop. And we normally do something called CPR, which is where people jump and press on your chest as hard as they can lead to broken ribs, and patients can end up with a tube down their throat. Now, even in a healthy individual, this has a low chance of success, but with patients that have medical problems or quite frail, this can even have a lower chance of success. And even if we do manage to restart someone's heart, they can have a reduced quality of life compared to how they were before their heart stopped. Now, with this in mind, would you like us to try and restart your heart if it were to stop? Or would you want us to just keep you comfortable? And then I give them that opportunity to think about it. They may give me an answer there and then, or they may ask to have a little bit of time to have a chat with their families, and then I would organise a future chat in a couple of days or a week or so to discuss it. Now, once you've had all those discussions, the next thing would be to talk about the respect form, and I've put it up here. And this is just a form that we use in the UK to document everything about their future wishes and if they want to be resuscitated or not. Now, on the respect form, there are also parts that you fill out on the back, which states if the patient has capacity or not, or if not, if you did a best interest discussion with anyone. And it also has a place for you to sign your details and if you've reviewed the form at all. And what you normally do is give them the copy that they keep at home. Now, this is a big thing for GPs because there have been a lot of times where patients have lost their respect forms. And these days, with everything being electronic, a lot of the respect forms are initially done on the computer. So make sure there is a copy electronically in their records. So if it were to get lost, we can easily just print off another one for them to keep at home. Okay, so you've had all the discussions now with the patient. The next step is to review medications. So the first thing I would recommend doing is having a look at their regular medications that they are already on and stopping any that will not provide the patient any benefit. For example, statins or bisphosphonates, as these medicines work over a long period of time. And then next, you would focus on any symptoms they're currently having, such as nausea and agitation, and prescribing any medications to sort this, and we will cover this in another video. Another thing to consider is if they can take these medications orally, or if you have to change the form to like a liquid or anything, or if they are really struggling, then to consider a syringe driver. And this is just where a little tube is inserted just under the skin and it injects the medication over 24 hours. And this is what the device looks like. It's just up here. Another thing to prescribe is what we call just-in-case medications as well. And these are medicines that treat all of these common symptoms that are just kept in the patient's house, and these are ones that are just given as a subcutaneous injection. So it's more for the district nurses, so if patients were having some extra symptoms out of hours or where the GP wasn't around, the district nurses can come out and give these medications. Now, something to make you aware of, the district nurses can only give these medications if there is a prescription sheet at the patient's house, and it looks like this. So in GP, make sure you filled this out, but also hospital doctors, if you are sending a patient home, please make sure you have filled out this form, because if the patient were to go home and it was something out of hours and they needed medication and the form wasn't there, it can lead to a delay trying to get that sorted. So please, 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 hospital doctors, make sure this form is filled out before you send the patient home. And then the final thing to do is to decide when you're going to review the patient again. That's obviously based on your judgment about how fast they're progressing, to decide if it's going to be in days, weeks, months. But again, this is based on a clinical basis. Well, that's it for today's video. I hope you found it helpful and learned something new. Don't forget to like, comment and subscribe so I know that you're enjoying this content. I've also included some of the resources down below in the description, especially for the Gold Standards Framework. And if you would like me to cover any other topics in future, then please comment in the comment section. I also do shorter videos more often on YouTube Shorts, Instagram and TikTok. So if you want to check me out on there, they're just up here. It's the same name, it's GP Made Easy. Or another way you can contact me is via email, and my email address is just up here. Well, I hope you guys have an amazing week, and I will see you in the next video. So, scripture for this week, I've taken from James chapter 2, verse 26, and it says, "For while bodily training is of some value, godliness is of value in every way, as it holds promise for the present life and also for the life to come." So have a think about that and see what it opens up in your heart. But also, if you want to check me out, I've also got playlists down here or some more videos up here. Also, don't forget to hit the subscribe button, and it's just there. Well, have an amazing week, guys.